BioPA here with 911 BioCare. I'm going to talk to you today about the myths versus facts of hormone replacement therapy for women. So let's kind of get into this and let's talk a little bit about the background. In the past, traditionally in medicine, hormone replacement therapy has come down to one medication mostly, called Prempro. Some of you may be familiar with this. There was a big health study done for women called the Women's Health Initiative many years ago, and it was famously shut down before the study was completed because of the much higher rate of breast cancers that the women in the study were having. And this was, they were using a product called Prempro at the time in a quote-unquote full-strength version. And they didn't really know what was going on, but they shut everything down. Later on, they decided to re-release Prempro in a lower dose, about half dosage. And to my knowledge, they've never done a follow-up study on Prempro since. And Prempro is still used today. Our research in the anti-aging community has shown that primarily the problem with Prempro was in the progestins, and progestins are synthetic progesterones. Okay, so technically when you use the word progesterone, you're talking about bioidentical products. When we say progestins, that is synthetic. Now, unfortunately, a lot of the media and other folks use those terms interchangeably, but they shouldn't be, because there's a big distinction. Progestins, synthetic progesterones, to my knowledge, have no benefit over progesterone. From looking at the molecule, to me, it looks like all they did was add another little molecule to the tail in order to patent that as a medication, because you can't patent progesterone. There really was no benefit to it, as far as I can tell. And our research has shown, and research over the years has shown, that synthetic progestin was leading to a higher incidence of breast cancer. It was dangerous. Progesterone, natural bioidentical progesterone, on the other hand, has been shown in test after test and study after study to in fact be anti-cancer, protective against cancer in many ways. And in some cases, women who have had breast cancer are given bioidentical progesterone as protection against future cancers. Let's look at the other portion of the Prempro, which is called Prem or Premarin. Premarin is where the estrogen comes from. Premarin stands for pregnant mare's urine, which is where they get the product from, horse urine. As far as we know, there's nothing dangerous about Premarin. However, there's 3 estrogens in it. Only one of them is human. The other 2 are equine. So unless you're a horse, those 2 aren't going to do you any good. We don't think they're going to hurt you, but they're not going to help you. And in my experience, women just don't feel as good. They get some improvement on it, but they don't feel nearly as good as if they use a bioidentical estrogen product. And usually we're talking about something like Biest, where we only use 2 types of estrogen in there and we leave out the third. There's 3 main types of estrogen in the female body. One of them we think, in some ways may be linked to causing higher incidences of breast cancer. The other 2 are definitely not, as far as current research has shown. And we've done pretty extensive research. So that's the totality of that story. The other thing to keep in mind, number one, we want to use bioidentical products if we're going to do hormone replacement therapy in anyone, but especially women, is what I recommend. Number one. Number two, and this should be kind of universal, but you never ever give estrogen without progesterone to balance it. One of the big problems that we see, and I would almost call it an epidemic at this point, in women as young as in their 20s, are progesterone deficiencies. And those progesterone deficiencies, by definition, make that person estrogen dominant. Okay, you can be estrogen dominant in two ways. Number one, you could have too much estrogen, which can happen, but it's rare. Or number two, you can have too little progesterone. Because if you don't have the progesterone to balance the estrogen, things are off. If you have too much estrogen, things are off. But more commonly, it's not enough progesterone. So being estrogen dominant puts you at risk for breast cancers, cervical cancers, endometrial cancers. Even in men, if you have too much estrogen in your system, it can put you at higher risk for prostate cancers. So it can be too much estrogen or unopposed estrogen can be inflammatory to the system, and for that reason alone, it can be somewhat dangerous to the body on a long-term basis. Also, if you have too much estrogen, some of the breakdown products of estrogens and progesterones, if you have too much, can be dangerous as well, which is why we never want to really oversupply the body in these things. We always want to optimize the body. So we have to optimize and we have to have balance. One last thing that I'd like to throw out there to our female patients or any women looking at the video is to also let you know that these synthetic progestins are found in almost every birth control product out there. That includes the injections, the rings, pills, the under the skin depositions, all of them. And your birth control pill is basically a combination of some sort of synthetic estrogen, probably Premarin based, a synthetic progestin, and then usually a sugar pill towards the end. So keep that in mind, because we're seeing a lot of dysfunction when it comes to women coming in on birth control pills. We're seeing a lot of mixed up labs and women that don't feel well because we're using synthetic progestins, and even though they're at low doses, it may not be optimal for your health over the long run to be taking these. It would probably be much better to be taking some sort of bioidentical progesterone or something along those lines in order to balance the system, especially when we're talking about problems like taking birth control for acne, or being given birth control or synthetic progestins because of abnormally heavy menses or bleeding throughout the month. Those are things I think bioidentical progesterone would be much more safer and much more appropriate in those cases. So just a little bit of information for you. You can certainly find out more information on the internet. I'll also try to put a link to Dr. Edwin Lee's book called Look Good, Feel Younger, which goes into detail about the risks versus benefits of estrogen, progesterone, testosterone for men and women. And so if you're interested in learning more and having a book that will go back and tell you where all the studies are and give you references to them as well, that's a great resource for you. Once again, thanks for watching, and be well.